neck pain are among the most debilitating problems that people deal with. Since the cause of pain is not always the same, our next guest specializes in custom treatments to get the best results for you. Please welcome Dr. Sam Bailey from Spine Treatment Centers of America to tell us how. Hi there.
Thank you. Good morning.
I mentioned that, if you don't have back problems, you don't know what people are talking about, but it's probably the most debilitating of issues people deal with that keeps them home from work and keeps them out of the game of life, really.
What a lot of people don't know is that failed open back surgery syndrome is the #1 cause of disability after heart disease and cancer. So it is a huge problem in the United States.
Yeah, and the problem, of course, is a lot of people may be suffering in silence because they've heard these horror stories. And oftentimes it was either dealing with medications, very difficult to deal with, or, as you mentioned, those failed surgeries that could cause more scar tissue. That's why what you all do is you don't take just kind of an approach that try to fit everybody into. You look closely at what someone's specific problem may be and try to customize something that can give them the best outcome.
The great news is that over the last 20, 30 years, there have been some tremendous advances in spine procedures. And Spine Treatment Centers of America has been formed, and here in Houston specifically, to bring together the very best doctors for treatment plans for patients who are suffering, so that we make sure that a procedure is matched to a patient and that they get exactly what they need in the least invasive form possible to alleviate their pain and suffering.
Yeah. What is the #1 reason for back pain?
#1 reason for back pain is impingements of the spine that are created either by the aging process or by injury. It's spinal disease or it's injury that creates these problems.
Yeah, and so you have an example of the spine right here, which most of us will never see a real one, right? But and so there's all kinds of things going in there. It's not just the bones that we're talking about.
Well, and like I said, you may not be aware of this, but Houston has a group of doctors that have done extensive research that has really impacted the world of science in reference to understanding the complexity of this creation.
Right.
It's like you say, the bones, the muscles, the ligaments, the nerves, the discs, very complex structure. Therefore, a simplistic approach should not be given to correct the problems. That's why we offer over 40 different procedures to help people to find alleviation from herniated discs, spinal stenosis, things of that nature.
Go through some of those procedures that somebody might benefit from.
Okay, well, we have one procedure that accesses the natural opening of the base of the spine that can actually affect the entire length of the lumbar spine with a laser. It's a great diagnostic tool. We have other procedures that are highly minimally invasive that can thin the ligament that often presses against the spinal cord, creating spinal stenosis. We can deal with discs. We work with neurosurgeons, orthopedic surgeons here in the Houston area, over 12 physicians in this area that can remove bone or any of the impingements that press against these nerves and create pain that radiates down to the legs or from the neck down into the arms and shoulders.
Yeah. At what point should somebody come to Spine Treatment Centers of America or Spine Treatment Centers of Houston?
When all conservative forms of treatment have failed and they realize that they're probably going to be a surgical candidate, that's when they need to contact us.
Yeah. And at what point should you get in? I know there are times that we've lifted something and it can feel like, you're just flat on your back, literally.
Right.
But the injury is not, so it's muscular, it's not really the spine. So what are some of the key things we look for when you say, you know what, you didn't just pull a muscle, you probably need to get in before you cause further damage?
If you've had pain for 6 weeks or longer, that's, for a lot of doctors, that's the time that you need to start looking at something serious in diagnosis. Get an MRI, talk to a physician, contact us. There's no obligation. We have patient advocates, and that's the great thing. A lot of people just don't realize how much technology is out there, how to access it.
Yeah, and new technology, as in if grandpa or daddy had a back surgery way back when and the recovery was long and painful, today it's different.
Things have changed. And if they'll contact us, we'll help match them with the right physician and help answer the questions. That's the most frustrating thing about medicine today, is getting through the system to get to the doctor that you need to address your problems. That's why we exist.
The other concern is there are people who will medicate the symptom. And the problem with something like this, if you have an injury, your medication could tell you you don't have any pain, but if there's something wrong, you could be actually causing more damage by still operating like you're okay.
Is it palliative or is it curative? Palliative is simply putting a Band-Aid over the pain and having to take continual medications. Not good for any part of our body. Curative is we go in and we remove the impingement and create long-term relief from the pain, which is what we're trying to do.
All right. Well, more information on Spine Treatment Centers of America, you can call or log on to HoustonSpineCenters.com or call 281-810-9444, 281-810-9444. And you can attest to the fact that there are people who really felt like life was over, and then they come back.
I've had the procedure. I can attest to that.
He's not just the president.
I know all about it.
He's a patient too.
I know all about it.
Yeah, but it is very freeing, isn't it?
Yes, yes, definitely. When you can't sleep at night, when you're having pain radiating down your leg, your shoulder, into your hand, and it's continuous, it's chronic, it is debilitating and life-altering. So when you find relief from that, it's a game changer.
He's smiling. All right. Thank you
Exactly.
very much.
Thank you.